Thank you for joining us today for Cape Chronicle. I'm Audra Kane. Today we will be talking about mental health and our community needs. Southeast Health, a major medical provider in this region, is partnering with Universal Health Services to build a new 102-bed behavioral health hospital. And Ron Escarda from UHS is here to discuss the new facility and the impact it will have on our region. And Melissa Stickle, the Executive Director of Community Partnership of Southeast Missouri, is here to talk about the programs, projects, and initiatives of her organization that also impact our area. That's all ahead on Cape Chronicle.
I'm Rudy Tempesta. I'm 92 years old. I fought in World War II. Then I came home, worked for the post office for 70 years. I've been getting Meals on Wheels, and I enjoy it. The most important thing about Meals on Wheels is you meet the people, which to me is fantastic. You need people to keep your brain moving. That's what life is about. It's love and having a conversation with people.
Welcome back to Cape Chronicle. I'm Audra Kane. Mental health often dominates the headlines and our news feeds. From substance abuse to family counseling to crisis interventions, mental health has often been cited as a top priority in local public health studies. Today, we welcome Ron Escarda from Universal Health Services from King of Prussia, Pennsylvania, to discuss the new Southeast Behavioral Health Hospital that will serve the Southeast Missouri region. Welcome, Mr. Escarda.
Thank you very much.
It's very nice to have you here. I know that you have come in from out of state specifically to chat with us because there are probably people in our area who do not know that this is happening, may not understand why, or the significance of Universal's involvement in this partnership with Southeast Mental Health. So tell us about Universal first, because there is some weight to your organization. There is some there are resources that you have that you bring to this partnership, and tell us about that.
Sure. Our company started in 1979, so we just celebrated our 40th anniversary. Obviously, as you mentioned previously, we're headquartered in King of Prussia. And we have a company that focuses on two unique segments within healthcare. We have an acute care division that runs what most people understand to be med-surg hospitals, medical-based facilities, and then we have a behavioral health division within our company, which is currently the largest provider of behavioral health services in the United States. We currently operate, it changes pretty frequently, but about 250 behavioral health facilities in the U.S. We also have large holdings and a network in the United Kingdom, in England, and also in the Virgin Islands and in Puerto Rico. And we currently operate behavioral health facilities in 37 states in the U.S. You say that the behavioral health side of the company changes frequently. Is that because you're seeing such an influx of need? Correct. I mean, a part of what we have spent the last probably 5 or 10 years doing is as demand has continued to grow for behavioral health services, and as communities have really wrestled with the issues related to mental health, the lack of access, the lack of capacity, in a lot of communities, even the lack of providers and prescribers. Our role and what we have done fairly extensively is really work with local communities and organizations like Southeast to help fill a need and bring our expertise in delivering the specialty services that we provide to those respective communities, either on our own or more frequently over the last several years in partnership with other community-based healthcare organizations that recognize a need and also recognize the strength and the benefit to having a partner with our experience and the scope that we're able to bring to bear to these projects.
What was it about the Cape Girardeau area that really interested Universal as to why they would seek out this partnership?
Well, it was a combination, but I think Ken Bateman, who obviously is the visionary leader of Southeast, certainly recognized that there was a significant dearth in services in this part of the state of Missouri. It has one of the lowest population bed counts of a lot of the communities that we typically operate in. So there is a tremendous unmet need in the community. And it's also a community that gets patients from a wide range outside of the immediate vicinity. So there's a tremendous amount of in-migration that occurs to access health services in Cape Girardeau. And so that's how the relationship started. They reached out to us and we began to have the dialogue around, is there an opportunity to work together? That quickly moved in a positive direction, and we were able to submit and then secure the certificate of need in the state of Missouri for the operation of the beds. And we are currently, I'm glad to say, in the construction phase. So we've broken ground and are in the process of completing the construction of the new 102-bed facility.
And the location of the facility is like it's off of I-55.
Correct.
Just north of Cape Girardeau.
Correct.
Exit number 95, I believe, or just south of Cape Girardeau, I should say. Exit number 95. So
I think that's correct. You might know better than I.
Research, and I've lived here. So the new facility, though, can you describe it a little bit more? 102 beds.
Absolutely.
Doesn't really say a whole lot. So tell us about it.
It will be a state-of-the-art behavioral health inpatient facility. And what I mean by that is it'll have all of the most recent design elements to create a safe and therapeutic environment for our patients and their families. It'll be a completely secure facility, so it's a locked facility. And it'll have 4 separate and distinct programmatic elements or units within it. We're hoping to have 2 adult units. An adolescent unit, which we are anticipating is going to be in great need since there's such a shortage of pediatric and adolescent services in the community, and then more than likely an older adult and gero program to round out the complement of the 102 beds.
How, in informing the plan for this facility, how did Universal go about deciding what need there was and who would be best served by it?
So we typically do a fairly detailed analysis, both of the demographics, of the available current resources, of the existing provider community, what services are currently available, and then we take all of that information and we distill it, and we essentially do a fairly complex needs analysis to determine what are in fact the needs and what are the resources really that are available in a given or respective community.
It almost sounds like this is a big facility. Would this be considered, as far as Universal is concerned, would this be considered a large facility?
It would be a medium to a large facility for us. I mean, we have a number of facilities that are in excess of 200 beds, so those are considered fairly large facilities for UHS. But the 102-bed facility will be considered a fairly good-sized facility, in particular for a community the size of Cape Girardeau. One
of the things that I thought of as I read through the information about your company was the fact that this will be a well-supported endeavor. Correct. In this partnership. Sometimes I think that companies come in and they partner with a hospital or a clinic or something like that, and they create something, but then they're out the door. And that's not what you all do. No, we stay very, very intimately involved in the operation of the facility. Support the facility locally. We have one of the strengths of UHS really as a company is not only our focus and commitment to our patients, which really drives our mission and vision, but it's also to provide ongoing support and in a very positive way. We have a tremendous amount of resources available to our facilities once we build them and we launch our projects to really help the long-standing operation of the facility. So we provide support in relation to information technology. We provide support in relation to regulatory compliance. We provide support in relation to risk management and performance improvement, quality, all of the different facets that really support a successful
behavioral health operation. And so we're prepared to do that and are looking forward to the relationship and the building of the facility, but then really the operation of the facility and integrating with the community and helping to be an active member of the community and to be hopefully a leader in the mental health community going forward.
Absolutely. Those performance standards, those are the behind the scenes type of operations of a corporation that a lot of people don't get to see.
Right.
They'll see, and I say we'll see on the other side that patient interaction.
Correct.
How do you go about training, the leaders of the staff in order to hire? Because there's going to be staff that will be hired, correct? This is
quite a bit of staff that will be hired from the local community, absolutely. We
Okay.
typically do that as well.
So how do you form that partnership with the facility itself in creating an employee base that is able to handle this type of treatment?
Well, as I previously mentioned, UHS is a company that has an incredible amount of resources that are available to us, not the least of which is in our training and education department. We have both an extensive library of online available education and training tools through our HealthStream system, but we also have a tremendous amount of access to a variety of different curriculums for specific patient populations and for training all of the different segments of the staff who will be managing and caring for our patients and participating and reaching out into the community as well.
Well, I tell you, it's exciting to know that there's a corporation that's represented by people like you who actually care about the kind of facility that you're bringing to Cape Girardeau and the surrounding area. A lot of programs, a lot more information. I know that going to the UHS .inc or UHSinc.org
right.
or .com, finding out a little bit more information, but then also reaching out to Southeast in order to find out more information about how this facility will work. I know that they have a marketing department that can answer questions like
Absolutely.
that. So it's great chatting with you. A lot of information. We didn't even get into the meat of the treatment programs that I would love to talk about, but we've been talking. Thank you so much for coming and chatting with us today. We've been talking with Ron Escarda from Universal Health Services. We appreciate your time.
Thank you very much.
Thank you for coming by today.
The invitation.
You bet. Up next, Community Partnership Executive Director Melissa Stickle. Stay tuned for more here on Cape Chronicle.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
I've been delivering Meals on Wheels to Leon for 13 years.
It's always a pleasure to see you.
Leon has definitely inspired me to put more into my relationships. He really cared for his wife, who was ailing for quite a while, in such a touching way that inspired me to be a better person.
Drop off a warm meal and get more than you expect. Volunteer at americaletsdolunch.org.
America, let's do lunch.
Bye-bye.
Hi. Hoping for a crisp breeze to help keep you alert. Oh, he took a sip of water too. That'll probably help. You were probably going to turn down the radio too, so you could focus, right?
Probably okay isn't okay.
Right.
If you see a warning sign, stop and call a cab, a car, or a friend.
I think the water line is what really drove it home. I blew on him.
Welcome back to Cape Chronicle. I'm Audra Kane. We were chatting earlier with Ron Escarda from Universal Health Services, and I changed my mind. Decided we needed to continue our conversation because we didn't even get into the meat of what I really wanted to talk to you about, was the programs that will be offered through this mental health facility that are amazing and unparalleled. Lots of trauma therapy, cognitive type therapies.
Right.
Start off with whatever your favorite is.
Sure. So we provide a fairly holistic treatment model. And our basic function is a multidisciplinary treatment team. So we have psychiatrists, nurses, psychologists, and other professionals that collaborate on developing an individualized plan of care for every patient that we care for and that we treat in our facilities. And we also bring a lot of ancillary services to bear as well. We do recreational therapy, occupational therapy. In a lot of our facilities, we have yoga. Yoga providers from the community will come in and provide groups and activities. We do pet therapy,
When you say pet therapy, what do you mean?
We literally have therapeutic groups and activities that involve a trained therapy dog and handler to help facilitate expression. It has a calming, very powerful influence on people, as most of us who are pet owners are acutely aware. And just a variety of different treatment modalities. Within the facility itself, in the 102 beds, it's obviously an inpatient facility, but typically we also build out a fairly extensive outpatient and ambulatory care network. So we anticipate over a short period of time after opening having partial hospitalization services, which are the next level of acuity down from inpatient, and then intensive outpatient services, traditional outpatient services, and we'll have prescribers who would be available to the community to prescribe psychopharmacological medications as needed and as warranted and as ordered by the medical staff. So it'll be a fairly comprehensive inpatient and outpatient continuum of care that'll be available to the community.
When you say outpatient, and because I think that sometimes people, and regardless of how hard we try to work to take the stigma away from mental health, people, they get scared.
Yes.
They get scared when they hear mental health facility because they're like, I don't want to go to the hospital. I don't want to be in there. But when you offer them something that's on an outpatient basis, so coming in for those treatments like the yoga or say music therapy, those are the kinds of things that people can seek out in those outpatient type of...
In some of our outpatient locations, we have all of those programs and activities available. I was referencing them mostly in regards to how we help support the inpatient population that we're going to be treating.
Right. Yeah. So, and I guess taking that stigma away from, mental health treatment.
We're still trying.
That's what I was going to say. It's probably one of your biggest goals as a corporation.
Absolutely. We've worked very closely with community groups, namely NAMI across the country, the National Alliance of the Mentally Ill, which is one of the largest advocacy groups for the mental health clients and mental health patients. And a lot of the activities that we do in the communities are really to reduce the stigma of mental health, to encourage people to get help, to seek help if they are having trouble themselves or they have loved ones who are struggling with a mental health issue. We've seen how much that has continued to grow in its pervasiveness in our communities, and the current rate of occurrence is very similar to cancer. They say 1 in 4 people end up with cancer at some point during the course of their life, and I think the numbers are pretty similar. It's about 1 in 4 individuals end up in a mental health crisis of some kind over the course of their lifetime. So the prevalence is fairly significant and growing.
Ron, what's the estimated date of opening for this facility?
We anticipate that the facility will be open in December of 2020.
All right.
So we're just outside of a year away.
Okay, this time we're actually going to say goodbye for good.
Thank you again.
All right, thank you so much for coming. We've been talking with from Universal Health Services. We appreciate your time and your being here with us today. Up next, Community Partnership Executive Director Melissa Stickles. Stay tuned for more on Cape Chronicle.
Let me tell you about the toughest guy on earth. He has the crazy strength to lift the man that raised him up without even flinching. This guy, this warrior, will always be by his father's side, even if his dad will hardly remember. If this guy isn't the toughest guy on the planet, then I don't know who is. Caregiving is tougher than tough. Find the care guides you need at aarp.org/caregiving.
At Southeast Missouri State, we've been launching the extraordinary careers of educators for nearly 150 years. But that's the thing about educators. They're always ready to learn more, discover new paths, and push themselves to the next level. With our new online educational leadership programs, you can earn the credentials needed to move up in your career. With flexibility for your schedule, accelerated courses, and an affordable price, together we can transform our learning communities and prepare you to conquer your goals.
Welcome back to Cape Chronicle. I'm Audrey Kane. 30 years ago, Missouri State Representative Mary Caston created the Community Caring Council in Cape Girardeau, giving rise to similar organizations across the state. Countless individuals and families have sought housing assistance, essentials, and numerous other services. Today, they are known as the Community Partnership of Southeast Missouri, and we have their executive director, Melissa Stickle, here to give us the latest. Melissa, it's so great to see you.
Yes, thank you for having me again.
You bet. It's kind of exciting because there's something new happening with the community partnership. You're getting a new facility.
We are. Hopefully soon.
How exciting. So the police moved to their new facility and you get what's new to you. And how much bigger is it compared to where you've been working?
It's about triple the size of our current space.
Nice. And so what kind of changes, what plans do you have? Tell us about the facility and how you'll be implementing it.
Sure. So we're obviously relocating all of our services over there. All of our administrative and current programs are all going to move. We're currently on 3 floors of a really disjointed building, and we're cram-packed in there, and over the weekend we had a big leak, so we're all looking forward to this new space. So our offices will be there, but more importantly, we're going to be able to increase the level of services that we provide to the community. And probably the most exciting is going to be the Homeless Resource Center that we will create out of part of the space.
Okay, and so when you say that, the Homeless Resource Center, what does that mean?
Sure. Well, first off, it's not a homeless shelter.
Okay.
We get that question quite often. And we will not be overnighting people in this facility.
Okay.
But what we will be providing is all of those day supportive services that those individuals have trouble getting access to now, in order for us to be able to connect them to all of the other things that will get them housed. So, for instance, showers and laundry facilities and mail services and just a space to exist in a safe, calm, it's a space. It's a place for them to exist and know that we're affirming their human dignity and that they just can exist.
Absolutely. Sometimes that's all they want is to feel like they're important to someone and that they're respected.
To feel included.
Yes, absolutely. Well, and you all do a fantastic job of not only serving the homeless, but you serve the community as a whole. So what are some of the other things that you may be able to improve with this new facility?
Yeah, a lot of people will recognize us as kind of the housing go-to in the community, but we do a whole lot more than that. Mm-hmm. We have mentoring programs for young parents. We have senior socialization programs. We have programs that serve at-risk youth in those facilities. We do community needs assessments. We bring people to the tables around issues. We provide fiscal agent services for some area nonprofits. We work to strengthen other nonprofits when maybe they don't have the capacity to do that. And we are a pretty well-rounded agency, probably with touch points in every spectrum from cradle to grave.
And for people who don't know, a lot of times in the past, churches were providing services that you now facilitate for them, and they work with you to provide for the community, right?
Yes, we have some significant church support who have recognized that they might not have the capacity to serve the daily needs of clients in a way that really moves them to the next phase of, instead of just being a handout. And so they actually support us monetarily in order to provide those direct services to clients.
Right. And those funds go for things like helping people pay their electric bill or pay their rent or things like that. Am I right?
Yes, but not just that. Things like boots to go to work, identification so that you can go to work, birth certificates so people can prove who they are for housing related needs, medications, all sorts of things. It's not just utilities and rent.
Right. A lot of people don't realize you can't get a job if you don't have a license, or you can't get your license if you don't have your birth certificate.
It is a slippery
And if
slope.
you don't have a job, you don't have the $16 to get your license, right? So
yeah, it's it's a barrier, and it seems small to some people, but it's a big enough barrier that it inhibits people from moving on.
Yeah, if you have $5 until your next paycheck,
you're not thinking about 1/3 of an identification price.
No, it's like budgeting is out the window at that point. So you offer a wide variety of programs. I know that there is a website that people can go and visit to find out more about those.
Yep, it's www.cpsemo.org.
CP, Community Partnership, CMO.org.
Yes.
Well, and there's everything from parenting to connecting people, homeless people with services. I mean, like, it's all on their website. So
it's pretty deep. I always say our services are deep and wide.
Great. Well, thank you so much, Mrs. Stickle. Great to have you here with Community Partnership of Southeast Missouri. Thanks again for coming by.
Thanks for having us.
And thank you for joining us today for Cape Chronicle. It is a service provided by the University, the Southeast Missouri State University Department of Mass Media and the City of Cape Girardeau. Our producer is Nicolette Brennan, and our executive producer is Dr. Jim Dufek. I'm Audra Kane. Thanks for watching.